Can you take too much omega-3? The short answer is yes, and it's something worth understanding properly before you reach for a high-dose supplement. Omega-3 fatty acids are genuinely important for your health. There are three main types, EPA and DHA, which come mostly from oily fish and marine-based supplements, and ALA, which comes from plant sources like flaxseed and walnuts. Your body can convert ALA into EPA and DHA, but it doesn't do this very efficiently. Many people don't regularly eat oily fish, so some consider supplements, things like fish oil, cod liver oil, or algal oil capsules. Now, supplements can be beneficial at appropriate amounts, but the idea that more is always better simply doesn't hold here. Official bodies do set intake guidance, but individual needs vary considerably, so rather than focusing on numbers, the key message is this: follow the guidance on the product label and speak to a healthcare professional about what's right for you. So what actually happens if you take too much? One of the most important concerns is increased bleeding risk. High doses of omega-3 can reduce your blood's ability to clot. For most healthy people, this effect is modest, but if you're already taking anticoagulant or antiplatelet medications such as warfarin or aspirin, this combination can meaningfully raise your bleeding risk. That's something to take seriously. You might also notice more everyday signs. Gastrointestinal disturbances are common. Think nausea, loose stools, or stomach discomfort. A persistent fishy aftertaste or fishy breath is another telltale sign. And unusual bruising or bleeding that seems to take longer to stop than normal is worth paying attention to. At very high intakes, research suggests there may also be a link to atrial fibrillation, an irregular heart rhythm. This is more of a concern well above typical supplementation levels, but it's worth being aware of. There's also a specific risk with cod liver oil that's separate from the omega-3 content itself. Cod liver oil contains vitamins A and D, and taking too much can lead to toxicity from those vitamins. This is particularly relevant during pregnancy, which is why cod liver oil is generally not recommended if you're pregnant or trying to conceive. Standard fish oil supplements don't carry this same risk, but always check the label. So who should definitely speak to a healthcare professional before taking omega-3 supplements? If any of the following apply to you, please have that conversation with your GP or pharmacist first. You're taking anticoagulant or antiplatelet medications, you have a bleeding disorder, you're pregnant or planning to become pregnant, or you have surgery coming up, and because the bleeding risk becomes especially relevant in that context. And a general rule for everyone: never exceed the amount recommended on the label or by your prescriber, and don't adjust your intake without professional advice. More doesn't mean more benefit. If you're taking cod liver oil and develop any concerning symptoms, speak to a clinician promptly. To recap, omega-3 supplements are beneficial at appropriate amounts, but excessive intake does carry real risks, including increased bleeding risk, gastrointestinal symptoms, and with cod liver oil specifically, the potential for vitamin toxicity. If you're in any of the higher risk groups, please speak to a healthcare professional before supplementing. This video is for general information only. It's not a substitute for personalized medical advice. Your GP or pharmacist is always the right person to guide you on what's appropriate for your situation. If you found this helpful, leave a comment below. We'd love to know what topics you'd like us to cover next. And if you haven't already, please do like this video and subscribe to the Bolt Pharmacy channel for more straightforward health information.